Cardiovascular diseases, or CVDs, are the leading cause of death worldwide. These diseases affect the heart and blood vessels, and they are a major health concern. In 2019, CVDs claimed an alarming 17.9 million lives. Heart attacks and strokes are the most common and deadly types of CVDs. They often occur suddenly and without warning. CVDs are a global issue, but they disproportionately affect low and middle income countries. This is due to a combination of factors, including limited access to healthcare, unhealthy diets, and lack of physical activity. The good news is that many CVDs are preventable. By understanding the risk factors and making healthy lifestyle choices, we can significantly reduce our risk of developing these diseases. Several risk factors contribute to the development of CVDs. Some of these are within our control, while others are not. Tobacco use is a major risk factor for CVDs. Smoking damages blood vessels and increases the risk of blood clots. Quitting smoking is one of the most important things you can do for your heart health. An unhealthy diet high in saturated and trans fats, cholesterol, salt, and sugar can also increase your risk of CVDs. A healthy diet includes plenty of fruits, vegetables, whole grains, and lean protein. Physical inactivity is another major risk factor for CVDs. Regular physical activity strengthens the heart and improves blood circulation. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Air pollution has also been linked to an increased risk of CVDs. Fine particulate matter in the air can enter the bloodstream and damage blood vessels. It is important to be aware of air quality and take steps to protect yourself from exposure, such as wearing a mask when air pollution levels are high. Early detection and management are crucial for improving outcomes for people with CVDs. Regular checkups with your doctor can help identify any early signs of heart disease. Your doctor may recommend tests such as blood pressure checks, cholesterol screenings, and electrocardiograms or ECGs. These tests can help detect any abnormalities in your heart rhythm or blood flow. If you are diagnosed with a CVD, your doctor will work with you to develop a personalized treatment plan. This may include lifestyle changes, medications, or surgery. Counseling is also an important part of CVD management. Your doctor or a qualified healthcare professional can provide guidance on making healthy lifestyle changes and coping with the emotional impact of a CVD diagnosis. Section 4. Deciphering the alphabet soup. Types of cardiovascular diseases. Cardiovascular diseases encompass a range of conditions that affect the heart and blood vessels. Some of the most common types include coronary heart disease, also known as coronary artery disease, is the most common type of heart disease. It occurs when the arteries that supply blood to the heart become narrowed or blocked. Cerebrovascular disease affects the blood vessels that supply blood to the brain. A stroke occurs when a blood vessel in the brain is blocked or bursts. Peripheral arterial disease affects the blood vessels that supply blood to the limbs, usually the legs. PAD can cause pain, numbness, and cramping in the legs, especially during exercise. These conditions often arise from the buildup of plaque in the arteries, a process known as atherosclerosis. Over time, this plaque can harden and narrow the arteries, restricting blood flow. Section 5. Your heart, your health. Embracing a heart-healthy lifestyle. The good news is that you can take steps to reduce your risk of developing cardiovascular diseases and improve your heart health. Start by making these lifestyle changes. Quit smoking. Smoking is one of the most significant risk factors for heart disease. Quitting smoking is the single best thing you can do for your heart. Reduce salt intake. Too much salt can raise blood pressure, increasing the risk of heart disease. Aim to consume less than 2,300 milligrams of sodium per day. Maintain a healthy diet. Focus on fruits, vegetables, whole grains, lean protein sources, and healthy fats. Limit saturated and trans fats, cholesterol, sugar, and processed foods. Exercise regularly. Aim for at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities at least twice a week. Remember, your heart health is in your hands. By making conscious choices and adopting a heart-healthy lifestyle, you can significantly reduce your risk of cardiovascular disease and live a longer, healthier life.